We know that the world is going through challenging times. We are yet to the fight against the pandemic. We are yet to win the fight against the pandemic. But we also know that if we have the right weapon, we can win this pandemic with much ease. What are the right weapons? Vaccination, COVID appropriate behavior, these are all there. But information and awareness are among the most important weapons that can help us fight this pandemic with much ease. Ministry of Information Broadcasting has been delivering these weapons to the public by providing right information and thereby spreading awareness to the public. Press Information Bureau has also been organizing webinars in order to burst the myths and also spread the right information. One second. Sorry. Sorry, guys. So, talking about the relevant topics, webinars have been organized on vaccinations, on mental health during COVID-19. Here, today we are going to talk about a topic many of us have been listening or hearing through news media reports, social media, and even from our friends. This one term has been ringing through all these times, especially in the recent times, mucormycosis. It has become a much bigger threat that COVID-19 patients are undergoing now. So, does every COVID-19 patient will be infected with mucormycosis, or mucormycosis and black fungus the same? I'm not the person to answer this. Hence, we have brought expert in this field, Dr. Rajiv Jaidevan, who can give us the right answers about mucormycosis. And before moving on to the webinar, I'll just give a brief introduction about Dr. Rajiv Jaidevan. He completed his MBBS and MD General Medicine from Christian Medical College in Vellore in Tamil Nadu. He was awarded the Madras University Gold Medal in MD General Medicine in 1995. He was awarded MRCP at Edinburgh in 1996. He underwent training in clinical epidemiology and public health at Erasmus University, Rotterdam, Netherlands. He obtained board certifications in medicine and gastroenterology from New York Medical College and spent 3 years in the UK and 10 years in the US before returning to his hometown in Ernakulam, Kerala. He's a gastroenterologist and a grassroots level social worker. Dr. Rajiv Jaidevan was the president of Indian Medical Association Cochin from 2019 to 20. During the pandemic, he has written several articles for doctors, policymakers, and the general public. So, welcome, sir. First of all, thank you for taking this time out amid your tight schedule to help our viewers clear their doubts. Before moving on to the welcome speech with Vinod sir, I request our viewers who have joined us online to please help post your questions on our YouTube comment session who have joined us online, because unlike the hospitals or clinics where doctors will be asking us many questions, here you have the golden opportunity to ask the doctor and clear your doubts. So please post your questions live. And now I request Vinod sir to please give the welcome address. Vinod sir.
Thank you, Dhanalakshmi. And good morning and welcome all of you to another session of knowledge sharing. Even as we try our best to protect ourselves from and cope with COVID-19, there is another threat being posed by a fungus, which we know and which we must know and we must act upon. Mucormycosis, a fungal infection, is being reported in few COVID-19 patients during or post-recovery. After recovering from COVID-19, one should closely monitor and should not miss any warning signs of the symptoms that we will discuss later in this webinar, as a fungal infection is found to be emerge even weeks or months after recovery. One should make regular monitoring of vital parameters like your blood sugar, as per your doctor's advice, to avoid the risk of infection. Early detection of the disease can ease the treatment of the fungal infection. As our moderator Dhanalakshmi had mentioned, we have a live Q&A session today. We have been joined by two doctors, Dr. Rajiv Jayadevan, who will be giving answers to your queries on mucormycosis, and we have with us Dr. Needa Rane, who is a prosthodontist, who will answer your queries on dentistry, a relation between good oral hygiene and general health, and especially good oral hygiene and COVID-19. As most of us you will be knowing, that government of India in the last year had announced a third stimulus package of Rs 900 crore for the mission COVID Suriksha, the Indian COVID vaccine development mission, which has launched to reinforce and accelerate the COVID-19 vaccine development efforts as part of the 3.0 Atmanirbhar Bharat. This mission is giving fruits now, and we have an update here. Union Ministry of Health and Family Welfare had finalized arrangements with Hyderabad-based vaccine manufacturer BioVisely to reserve 30 crore vaccine doses for distribution from the month of August to December 2021. And Afghan Biopharma and Maharashtra state PSU is getting ready to manufacture COVID vaccine Covaxin under the technology transfer arrangement with Bharat Biotech Hyderabad. As said, the vaccine administration in the country, just like before, it is the largest vaccination drive in the country. And we have mentioned in the previous webinars.
I think Dr. Vinod sir is
Like to
offline.
go through
Yeah.
our channel, our webinars. That's it from my side. Over to you, Kanch.
Yeah, thank you, sir. To our viewers, we would like to add on that Dr. Neeta is also joining us. As Vinod sir mentioned, she'll talk about dental health. So it is the most ignored area of COVID-19 because does the poor oral health affect or cause COVID-19 infection is also a question. So Dr. Neeta is here. We are pleased to have you, ma'am. I'll just give a brief introduction about Dr. Neeta as well, and then we'll move on to the session. Again, I repeat, viewers, please post your questions in our YouTube comment section, and our experts will answer your questions on mucormycosis as well as oral health. Dr. Neeta is an MDS in prosthodontics, crown and bridge, and implantology. She did her BDS and MDS from Rajiv Gandhi University of Health Sciences, Bangalore, Karnataka. She has worked with Government of Karnataka for Dantabhagya Yojana that provides free dentures to needy patients. Currently, she is a consulting prosthodontist in various clinics in Goa, and she is a chief dentist at Dr. Neeta's clinic in Goa. So, welcome you, ma'am. Uh, Now, yeah, without wasting much time, I request Dr. Rajiv and Dr. Neeta to please take on the session. Uh, can we begin with mucormycosis?
Yes, sure.
Yeah.
Let's do
Yes, sir.
that.
Yes, sir. So if you would like to add some points about it, and then we'll straight on go to the questions we have. Uh, so could you please give a brief introduction about the mucormycosis?
Good morning to all viewers. Good morning, Dhanlakshmi, Mr. Vinod Kumar, and Dr. Neither. So we're going to have a nice and productive session on what I call accurate information for the public. We all know that during the pandemic, it's extremely important to have the correct information. We are flooded every day with all sorts of information that typically comes from social media, and many of which is misleading. So here is an opportunity to talk with people who know the topic really well, and will be able to answer questions in a language that people can really understand. That's also important because science, for those who have not really taken up science as a major subject, the jargon can be quite confusing. So we assure you that whatever language we use here will be easy for everyone to understand, and we will not be hurried. We will take our own time to answer your questions, and that's important. You could ask questions that are of public interest, things that will be helpful for the community. And we are going through a crisis, but as I mentioned, there is a way out of the crisis, but if we follow the wrong information, in fact, we'll be going in the wrong direction. So this is a great attempt by PIB and Government of India to provide direct information by directly interacting with the general public. I'm Dr. Rajiv Jaidevan.
Thank you, sir. Um, Sir, regarding mucormycosis, I will just post my questions first. I think I also have a lot of questions. Uh, our viewers are also posting their questions. So, to start with, why there is a recent surge in mucormycosis? I heard that reports also say it was existing earlier also, even before the COVID-19, the first wave or second wave. So why there is a recent surge of cases of this infection?
Well, as you know, mucormycosis is a fungus infection, and it is not a single fungus. It is many species of fungi that are grouped under the name mucormycosis. Whenever people have depressed immunity, we all have an immune system that help us fight infections that are attacking us every day. And without our knowledge, our immune system is able to get rid of all the infections. But there are times when our immune system is suppressed, and having COVID 19 in the background of diabetes and steroid use is a classic setting of triple immunosuppression. See, COVID 19 is not an ordinary virus, as all of us know. More than a virus, it affects many segments of our body, more than was known last year. We now know a lot more about COVID 19, and it really has an effect on our immune system. The other aspects are, as I mentioned, many people in our country are diabetics. India is considered the diabetic capital of the world. India is a large country as well. We have a lot of people living here, and therefore, the number of people who fall sick also is much higher than in any other country. So, therefore, the mucormycosis cases that happen, it's quite understandable that if you have a very large number of people falling sick, some of them will come down with this infection. That's a fungus infection. And the vast majority are in that category. That is, as I mentioned, people with diabetes, or there may be people who don't know yet that they have diabetes. And then there are a few who take high dose steroids and they get the infection. And then there are a few who do not have diabetes or take steroids. They also get it, but those are smaller in number. So overall, I see it as a fraction of a very large denominator of people. A denominator in the sense, if you take the total number of people with COVID 19 in our country, yes, it's a very large number. And in that very large number, a tiny fragment is getting it. But even a tiny fraction or a tiny percentage of a large number is still a large number. That is why we are saying thousands of cases.
Okay, doctor. Thank you. Regarding this, I have one more question. So, as you said, since it is found in diabetic patients, so what is the relation between like diabetes? Even they have said that people with organ who have undergone organ transplantation recently may also be affected with this infection, fungal infection. So, is there like any direct connection between that?
Well, diabetes uh, affects a large number of people. Not everyone is immunosuppressed. See, diabetes is a disease that has a very large spectrum, almost like COVID 19. There are some people who have very mild diabetes, and then there are some with severe disease, and there are others with organ dysfunction. See, people with kidney disease, heart disease, and so on. So, diabetes itself is a very large spectrum. The section we are talking about here are the people with diabetes in whom the blood glucose levels or sugars cannot be controlled or could not be controlled for whatever reason. And when that happens, our body's immune system is not able to work properly. For those who are interested in biology, I'll mention a name called neutrophils. Neutrophils are, you've all heard of white blood cells, right? WBC and RBC in our blood. Now, these are our soldiers or policemen in our system. There are many of them. One such security system is called neutrophils. Neutrophils, their job is to pounce on any invading pathogen or germ and kill it. Now, neutrophils, their function is impaired or diminished or decreased in severe diabetes. So, people with severe diabetes, that's the reason why many of them get a little bit of infection here and there. You might have heard of people getting a cut in their leg, and that cut becomes infected, and the whole leg becomes infected. And in some cases, their leg needs to be amputated. We've all heard that. Now, all these start with the neutrophils. The neutrophils are not able to do their first job, and we've heard the usage a stitch in time. Right? A stitch in time saves nine. In our body, our neutrophils are involved with doing the first stage. So the neutrophils are able to get rid of early infections. We will not see these big infections that I mentioned. So likewise, in the case of mucormycosis, the neutrophils have a major role, and there are many other aspects of diabetes, such as a high sugar level in itself is conducive for viral growth, which means that there are, for fungus growth, which means that fungi love certain things, like we like certain foods. For example, I like jalebis. Yeah, so likewise, the fungus loves sugar. The fungus loves trace metals like zinc and iron. The fungus loves those. It's like manure. When you grow a plant, fungus is a plant. When you grow a plant, to make it grow well, you throw some NPK into the as fertilizer, right? Same way the fungus uses fertilizer in our body. It grows on dead tissue. Wherever there is dead tissue in our body, the fungus will grow. And tissues may look overtly dead. For example, if you see a gangrenous leg, you'll see tissue that's like really dark and dead in the body. But likewise, we can inadvertently kill tissue in our body. For example, if you have a burn, suppose your skin is burned with some, say, boiling water falls on your skin, and skin is burned for some areas, in some areas, that also is a segment of dead tissue. The body will eventually repair it, but until the body repairs that dead tissue, it forms a good medium for fungus growth. So, all of these, there are many factors that actually contribute to fungus growth.
Thank you, doctor. This is a common doubt. So, why this mucormycosis and black fungus the same? Like, can it be called the black fungus? Or and there are like other colors also coming up. Even memes are being made on this. Then there will
I
be
know.
like soon many more colors on a fungus will be coming. So, what is this relation? So, what is the only the color is the difference between all the fungus?
Yeah, but I want to say upfront that terms that are used in science are accurate and are very strictly defined. So when we talk in science, we don't use colloquial terms at all. But that can be difficult for someone without a background in science. So which is why people come up with terms like black fungus and yellow fungus and white fungus and so on. They're all scientifically inaccurate terms, and as doctors or as people of science, we don't use those. Which is why you heard me use the word. You just heard me use the word mucormycosis. But if we use the term black fungus, it simply means that somebody created this word, and it's a scary sounding word. For some reason, it rhymes as a very scary term. Black fungus has an ominous tone to it, and people get scared when they read it. And so, when you get scared, more people read it and they share with their contacts, and so these news get carried. Whereas if you just said cases of mucormycosis found in, let's say, Gujarat, people are not going to share that information. But if you say black fungus is found in Gujarat, you're more likely to share it among social media. So I'm talking about how news spreads in social media. So back to the question on black fungus or mucormycosis, it is really not black in color. If you really go into technicality, there is another black fungus, which we are not going to get into that at all. It is not applicable in this setting. The reason why somebody came up with this name is because this fungus, it invades our blood vessels. See, our blood vessels carry blood and oxygen to our tissues. So when the blood vessels are destroyed, our tissues, they do not get their oxygen supply. So when our tissues don't get oxygen supply, they die. And when tissues die, they turn black in color. And that is the reason why somebody gave it the name black fungus. The other names are completely inaccurate. I don't even want to discuss those terms because it's got no bearing with science. But briefly, I'll tell you one more thing, that when we talk about fungus infections, as I mentioned, it's not just one fungus. There are many fungi that take the opportunity to grow in settings like this. For example, suppose I have a sore throat. Let's say I don't have COVID-19, and I go to a doctor. Let's say I go to Dr. Neeta with either a sore throat or a tooth infection. Now, Dr. Neeta may look at me and say, "Look, Dr. Rajiv, you've got an infection in your gum, and I'm going to give you a course of antibiotics." So Dr. Neeta gives me a course of antibiotics. Let's assume I'm perfectly healthy before that. But when I take these antibiotics, which the doctor gave me, not only does the tooth infection get better, I also kill a good number of my good bacteria. Remember, our body is a living ecosystem. In our body, we have more bacteria than human cells. If you count the total number of cells, we have more bacteria. So when I take these antibiotics that the doctor gave me, I'm killing off a large number of these good bacteria. And these good bacteria, they don't cause disease, they help my immune system. So my point is, after a week, I may develop what is called a white fungus infection in my throat or in my soft palate, which is the top of my mouth. When I open my mouth, look in the mirror, I may see a white patch, almost like thick white curd, which does not come off. If I scrape it, it will not come off. So that's called candida. So that's another example of a fungus that can grow in the right setting. Candida is also known to occur in diabetes, in people with diabetes, and in people with immunosuppressed people. And as we can expect, Candida also has been found in people with COVID-19. So as I mentioned, this is not a case of a single fungus. Back to you.
Okay. Thank you, sir. Uh, Sir, I would just like to ask a question on the dental health, since you yourself pointed out about the if the fungal infection is found in our dental cavities. So this is a question for Dr. Neeta. Uh, Dr. Neeta, yeah. Uh, Ma'am, your mic is off, I think. Could you please switch on the mic, ma'am? So my
Now, am I
question is,
audible?
yeah, you're audible. Yeah. My question is, I think there are like very little reports about dental health and COVID-19. Is that many people might not even know if there is any direct connection between it. So could you please just say if there is any direct link between proper, yeah, good dental health and poor dental health with COVID-19 infection?
Okay, slightly broad question, but to answer it, I would say definitely there is a link because basically what we are trying to do is when we say good oral health, we are maintaining all the parts of the oral cavity. That is not just the teeth. So basically, when we say oral health, we just focus on the teeth, but then there are other soft tissues also, like gums and soft palate and other areas of tongue, everything. So when all of these are maintained in good health, that means automatically the viral load per se will also be under control. And as Dr. Rajiv rightly said, there are naturally present occurring microorganisms that are healthily present in the oral cavity also, like the rest of the bone. So those will also be under control and doing their good functions. I would say good functions, just for the public to understand. So hence, definitely COVID-19 being a viral infection would also be in check. And we must not forget another point linking the two is that the blood supply. So the blood supply is the same coming into the oral cavity and connecting it to the rest of the body. So that is also a major link why these two can be linked together. Hence, having a good oral health will also help in maintaining COVID-19.
Thank you, doctor. One more question. This is like there was like link between this mucormycosis and dental infection. So I read about mucormycosis affecting the jaw after this dental extractions. So is it true? Is there any connection between it? Like a person who has had a recent dental extractions can have mucormycosis?
So, as mentioned before just now recently, so mucormycosis is basically fungal, and fungal infections per se, like they are mostly always seen as being opportunistic whenever they are active. So whether be it after dental extractions, like you just asked me, or even otherwise post COVID-19, like we are seeing. So if the immunity, like post extraction, so what is the scenario? Like why are we highlighting this point? This post extraction, there is a normal wound that is developed because extraction is a minor surgical procedure. So if the wound is not maintained with good oral hygiene, we are again creating an opportunity for the coexisting microorganisms to become more active and harmful. Then again, this question comes into highlight. If you don't maintain the oral hygiene and the dentist instructions post extraction that we give, that is rinsing with a good Betadine mouthwash and keeping oral hygiene in check and making sure that there are salt water gargles also. So also sometimes we may advise certain packs which we place if we see there is necrotic tissue already present which was due to the maybe poor tooth condition, which is why the tooth went into extraction. So all these factors, if they are kept under check, that is the hygiene basically we're talking. So then there should not be an issue of mucormycosis post extraction.
Okay. Yeah. Thank you, doctor. So we have started getting questions from our viewers. I would like to ask, this is the question for Dr. Rajiv Jaidevan. Uh, Ashish Vaidya has asked, hello sir, if a person contracts COVID-19 after the first vaccination, are there chances of getting black fungus reduced? Mm, She wants to say if the vaccination can reduce the chances of getting black fungus.
Indirectly, yes. The reason is that after vaccination, even if you pick up COVID 19, in the vast majority of cases, it will be mild or without symptoms, which means that we all know now that if you take all the cases of COVID 19, the mild cases do not require any treatment, in the sense, no medicines are necessary. I repeat, no medicines are necessary in mild cases. I'm saying this emphatically because I see a lot of people taking a lot of unnecessary medications for a condition that will cure itself. Again, we are talking about mild cases. We know that some mild cases go on to become more severe cases, which is why doctors observe them very closely. So, back to your question. If the person received a vaccine and later developed COVID 19, as I mentioned, let's just assume it will be mild. So when it is mild, that person will not require steroids. So by default, their chance of getting COVID or steroid-related mucormycosis will be low. But this is where the problem comes. As I mentioned, instead of letting this condition heal on its own, if this person starts self-treating, looking at messages that come on WhatsApp, there are all kinds of misleading messages that come on WhatsApp and Facebook. Just yesterday, somebody forwarded a video to me. It's a woman who's standing in her kitchen. She has the pressure cooker on her stove. She has put some spices into the cooker, and she attaches a tube onto the top of the pressure cooker, and she's inhaling the steam that's coming out of the pressure cooker. She's claiming it is good for corona. See, we've all been given a body that works so fantastically well. We have a responsibility to protect it, to guard it from harm. If we do foolish acts like this, it will burn off our insides. Our insides are so delicate, they are not meant to be burnt by steam. So, back to the question, if this person engages in such dangerous behaviors, yes, the steam could go and burn off your internal tissues. If you take medicines that are not indicated, it may set up the stage for a fungus infection that would have never happened in the first place. Now, let me ask you a question. COVID 19 has spread all over the world. Millions of people have had COVID 19. Why is this not being reported from other countries, especially developed nations? Partially because they follow guidelines. They follow scientific guidelines. If the doctor says no medicines are needed, they agree with it, and then they go home and follow the instructions. They just take fluids, and if they get a little bit of a temperature, they may take a paracetamol, and they concentrate on reasonable food and diet and fluids and sleep. That's all that's needed for mild cases. But in India, the vast majority of people in our country engage in some form of self-treatment, and that is something I would like to strongly discourage. Just follow the basic instructions by the doctor who you are in touch with, and stay away from unnecessary medicines.
And doctor, you say that vaccination can, to an extent, prevent this infection, black fungus.
Absolutely. As I mentioned, indirectly, because the disease itself is mild, the chance that this person will require multiple medications or immunosuppressant medication like steroids is very small. Therefore, it will protect.
Thank you, doctor. There is one more question from Mahesh Chopade. How long after recovery one should be watching for signs of mucormycosis? So after
That's an
recovery, because yeah, most COVID
that,
recovered patients have this doubt.
yes, that's
Yep.
an excellent question. See, when we look at the people with mucormycosis, but I want to emphasize again that the cases of mucormycosis that we're seeing is a tiny, tiny percentage of all the people with COVID-19. So please, if you're watching this program and you or any of your family members have COVID-19, please don't be scared, because it's very easy to apply these facts to yourself or to your family member and say this might happen to us. So please remember, these are extremely rare complications. So that's the first point I want to get across. So back to your question. Can you repeat the question, Dhanlakshmi?
How long after the recovery one should
Yes.
be watching for signs
Yeah.
of
Many
mucormycosis?
people believe that mucormycosis only happens during the COVID-19 illness. That's wrong. Mucormycosis can also affect people who have recovered from COVID 19 in the initial few days to weeks. Because the effects of immunosuppression and the effects of the treatments and the virus will remain in the body for some time. Imagine a boat traveling through a river. Long after the boat has gone, you will still see the ripples in the river. Likewise, when a virus travels through our system, even after the virus leaves our body, our immune system will still be working for some time. That is why I said for a few weeks, it's important to be vigilant and, most importantly, not to do anything adventurous or experimental with your own body.
Thank you, doctor. I think you have put it very well. There is another question from Maunika Dharmarajan. Is mucormycosis due to reduction in normal flora of bacteria in body, since bacterial and fungal numbers are maintained by each other in our system? So it seems little
That's an
technical
excellent
question.
question from someone who understands the basics of biology and immunology. See, the topic of immunology is so vast that even with all my personal experience and my reading, I don't think I even understand a fraction of immunology. It is so vast. It's like space medicine, or it's like the cosmos. It's so big, and many of these components are still not understood well. So I want that to be clear first. So the question is, do bacteria have a role in our immune system, and do normal healthy bacteria protect us? Yes, there are so many studies that have conclusively shown that these good bacteria that live inside our body, they are on our skin, they're on our mucous membranes, which means they're in our throat, in our nose, in our gut. Wherever there is human tissue surface, there are bacteria. Now, they don't exist inside our blood, all right? So these bacteria are technically on the surface. Remember, our body has two surfaces. What we see, if we look at ourselves in the mirror in the bathroom, the skin that we see is the outside surface. If you open your mouth and look in the mirror, you'll see part of your insides. Now that is the inside surface. So there is an outer surface and inner surface. Bacteria thrive in both these areas. And in both these areas, our immune system has set up an army of multiple cells, immune cells, and immunoglobulin, which is basically antibodies that are there to fight infections. And the bacteria that live in these areas facilitate this. They improve our body's defense against invading bacteria. Just to give you a couple of examples, we've heard of typhoid, right? Typhoid is a bad bacterium. Cholera is a bad bacterium. I'm a gastroenterologist. Hepatitis A is a bad virus because it comes from the environment, it invades our body and causes jaundice. But these bacteria that live on inside our body, they are not harmful. But as I mentioned earlier, and as the viewer asked, if you disrupt these bacteria, yes, you're essentially disrupting your immune system. So prolonged use of antibiotics, unnecessary use of antibiotics is a strong risk factor for fungal and bacterial infections. Now, if you look at the latest paper, it's a beautiful research paper from ICMR. They looked at, I think, around 1,700 cases of infections that occur in the hospitals. They found that about 3.6% of these people develop what's called superinfection. Now, what is a superinfection? Superinfection is a bad infection occurring on someone who's already having an infection. That's called a superinfection. And that can be fungus or bacterial. And the reason is one, overzealous, unnecessary use of antibiotics, and unhygienic conditions. So both of these can contribute to infection. So back to the question of the viewer, absolutely right. If you mess with the good bacteria in our system, we are setting the stage up for multiple infections. Back to you.
Thank you. Thank you, doctor. There is one more question. What are the source of black fungus? See, many of us, even including me, the question is like the what we find on vegetables, on the clothes. Are these the source of mucormycosis infection? So, is there any connection between the infections?
Yes, it's a good question. And I also want our viewers to know that we are using a language which is understandable for everyone. So if there is a scientist in the audience, they may find this narrative too slow because we know everything already. This narrative may be a little too slow, but the vast majority of our viewers are not graduates in science. So we need to speak in a language that they will understand. So back to your question, the source of this fungus. Let me take you through an example. Let's just walk to our kitchen. Let's just say I find a loaf of bread that I bought last week and I forgot about it, or at least two pieces were left and I did not consume it. If I look carefully on it, I'll find a few spots on it. We call it mold, or it is darkish, greenish, grayish in color, sometimes even black. And as if I go back and look at it 2 days later, the entire bread will be covered in black or grayish, greenish color. That is mucor. Basically, it's rhizopus. Rhizopus is, as I mentioned, one of the species of fungi that are grouped under the mucormycosis group. Yes, it is there all around us. It is there on my table, it is there on my phone, it's there in my hand, it is there in my garden. So it is not like we can live in a space where fungi don't exist. That is the point I'm trying to make. So there is no need to be scared about the fungus waiting to attack you and so on. So I spoke with some seniors and they said they're not going out now because they're scared black fungus will attack them from the trees. I said, where did you hear that? They said, some doctors on the television said it came from leaves that are dried and decaying. I said, well, leaves have been dying and decaying for centuries, and these fungi have existed for centuries. So please don't be scared to go out. Please go about doing all your daily routines. Please don't be excessively scared, which is why I said people who are not well versed with science may get terrified when they read news like this, which is why I said these are extremely rare. And just because you walk in your garden or you go to your kitchen, you're not going to get black fungus.
Thank you, doctor. Now we have a question for Dr. Neeta. This is regarding dental health. Isn't brushing our teeth itself means that we are taking good care of our dental health? So, is there any other tips which we should keep in our mind to prevent the COVID-19 infection? So, many of us have this norm that, okay, we are brushing the teeth twice a day, so that is enough. I'm maintaining good dental health. So, can you please add on to this, doctor?
Yeah. So again, excellent question. We are seeing again in focus that oral health again we are concentrating just on the teeth. And like I said, we have so much more to that in the oral cavity. So yes, brushing your teeth is a good start. But if we look at it as all that's needed, then even that, we try to undercompensate. It's always like that. Like we have a broad spectrum and then we try to underdo it sometimes because acha, we are brushing teeth at least once a day enough. But first of all, brushing the teeth is not the only thing. Other than brushing, flossing is really very important, because brushing is again just covering the external surfaces of your teeth. Actually, typically speaking, just covering three surfaces of your teeth. So the other two surfaces, that is between the teeth, we're talking. So that gets really left out. So again, flossing is, I would recommend flossing daily, just like brushing twice. Then other than that, what else? Mouthwash is also recommended because it will keep the viral load in check when the situation is such that we have a viral infection that is prevalent in the huge community as such. So right now, mouthwash would also be better recommended. If you don't want to go for like alcohol mouthwashes, because I have seen some patients do have concerns that there's alcohol content in. So you can also go for non-alcohol based mouthwashes. Other than that, I would say just basic rinsing of mouth after having a meal, anything. Just basic, rinsing of mouth also helps a lot in keeping good oral hygiene in check. Yeah.
That is an echo. Yeah, thank you. Thank you, doctor. There is one more question regarding this dental health. Uh, for example, if many people, even like those people who consider dental health is not that important in human body, so many are even canceling their appointments with their dentist because of this fear of visiting hospitals or clinics, fear of getting infected. So because of that, they are like ready to live with their minor pain, which might be the beginning of some serious infection. So do you have any advice for those patients who are like uh, avoiding treatment or postponing their appointments just because of fear of getting infected?
So as of now, I would suggest that so if your particular local region has certain restrictions in place, like curfews and lockdowns right now, but even so, I think now we are approaching ends of various lockdowns in various regions also. So if the lockdown is in place, yes, just I would suggest go for only emergency care, and a lot of teleconsultations also help in managing the situation many a time. So I would say don't just be disconnected totally with your dentist or doctor, but be in touch, and your dentist or doctor will know if it calls for a physical visit if it's necessary. So if they do advise it, now you would say the fear is there that we might catch it, but we have certain guidelines in place so that the dentist himself and herself is safe, and the patient also. So what are these guidelines in place? We have certain specifications like good ventilation is the basic guideline for operatories. So having a good ventilation in check, and also a good suction unit, a high suction unit in place when we are doing certain procedures. So all these specifications, if they are maintained, I think, and of course PPE kit and all is become a regular. So with all these specifications maintained, there should not be a fear as such. But yes, don't be overzealous also these days with any appointment. But be in touch with your doctor. They will know when it is necessary for having a physical visit.
Um, and one thing, this is regarding the methodologies being used. Many people, there are like different methods to keep your teeth clean or in brushing their teeth. So many use this traditional methodologies like salt or neem twigs or such basic things which we have been like taught or are like elders do. So as a doctor, as a dentist, what would you advise, which is the proper methodology to practice in order to keep a good oral health?
Okay, so if you're asking regarding like the traditional practices, basically asking, right, in check. So based on that, anything specific you have in mind? What you're asking about?
No, there's certain things that the reports say, there are like the fluoride is more in the toothpaste, or it might
Okay.
affect the teeth. Finally, you should not use. You should use, which can again like just earlier the doctor said the bacteria also checks the count of fungi in our body. So if there is any connection with these.
Okay, so okay, that's a good point you brought up the fluoride thing. Like, okay, so it's been hugely a controversial in the public eye, But as far as we have understood, after all the research that has been conducted by all the experts in the field, the fluoride, a good controlled fluoride content does help in preventing and controlling decay in check. Okay, that is tooth decay. So, I mean, and it has been proved with various research papers also. So, this is something that has been established in the dental field, and it is just a fear in the public eye. The fluoride content, of course, anything that is overdone will, of course, be harmful. But the recommended fluoride content, if it is there, that is there in most of the toothpaste that we have, is good enough, and it's nothing to be fearful about. Again, if you want to ask about like the ancient practices of brushing and the toothpaste or products being used, we have to understand that a lot of times our lifestyles have also changed, and what may have maybe even worked back then, we cannot just stick to it and say. So research is always developing and growing. We're always learning new ways and better ways. So right now I would suggest that just brushing twice daily with a fluoride containing toothpaste is good enough, and flossing, of course, as I said, and of course mouthwash is recommended. And one thing that is forgotten is tongue health. So tongue scraping is also very much recommended. It keeps the hygiene in check a lot. And in some cases, especially, some people are more prone to have this layer of plaque and dirt stuck on their tongue. So if they keep that in check, that will be really helpful for them.
Thank you, doctor. One last question. If there is pain in teeth after recovery from COVID, is this related to mucormycosis?
Yeah,
Like
so there are
after
certain symptoms that we do see in the oral cavity that have been connected with mucormycosis. Pain in teeth as such is not really that indicative. More of we see like looseness of teeth, I would say. Then you can suspect, but then you can just suspect. Please confirm with your dentist, with a check with your dentist, and we can see looseness of teeth. We can see black patches in the soft palate, that is the roof of your mouth, that region. So those are certain dental indications. You can see sometimes slight jaw pain may be indicated, a mass, but not pain in teeth as such. I would say for mucormycosis, that could be probably a normal dental decay that is there. But of course, do confirm with the dentist. They will do the investigations or X-rays if needed, and then confirm.
Rajiv Jaidevan. Um, Sir, this is the question from Deep Joy Mampalli. Has there been some change in evolving evidence available regarding mucormycosis infection? Has there been some
Yes.
change in
Yeah.
evolving evidence available regarding mucormycosis?
It's a very good question by Mr. Mambali. See, traditionally, if you look at cases of mucormycosis, or what is colloquially called black fungus, it has been traditionally described in immunosuppressed people, people with decreased immunity. And who are these people? They are either poorly controlled diabetics or people who are receiving certain medicines after transplantation. See, after you receive an organ, you need to keep your immune system under check, because if you don't keep your immune system under check, it will reject the organ. So, which is why most people who received an organ, a new organ, say liver or kidney or any other organ, require long-term immunosuppression. So these people are where the predominant category of mucormycosis patients. But over the past month or two, we have seen a rise in mucormycosis in people who don't have these conditions. So that is one of the, from a scientific standpoint, it is a development, it's a new entity. Almost like COVID-19 itself is a new disease that started in late 2019. Likewise, this mucormycosis wave is something new. It's science in evolution. We are literally seeing science unfold under us, and we are now discovering through studies that many people who are coming to hospital with mucormycosis were just treating themselves at home. They are not diabetic. They did not receive oxygen, and they did not take steroids. So there are a good number of people that are coming to hospital with mucormycosis without any of these traditional risk factors. So studies are ongoing, particularly case-controlled studies, to find out if these people have additional risk factors, which I briefly mentioned in the beginning of this talk. So we don't know if these are definitely related, but until comparative studies are done and these numbers are confirmed, we can't say for sure. But if you look at biological plausibility, there's something called biological plausibility. See, I'll give you an example. See, if somebody falls off a coconut tree from a big height, that person will be severely injured, right? You don't need a scientific publication in a peer-reviewed journal to tell you that falling from a coconut tree will give you a lot of damage to your body or even kill you. Likewise, there is something called, so this is called biological plausibility. Biological plausibility means if you fall from a very large height, you may die from it. You don't need a published paper for that. Likewise, if you look at the circumstantial evidence, we know that antibiotics are bad for you in terms of when they're not used when rightly needed, over excessive use of antibiotics, overdose of steroids, self-medication with steroids, failure to check your blood sugars, burning of your inside with steam. All of these are biologically very plausible that will increase the risk of fungus. But as I mentioned, studies will need to really confirm that these risk factors existed in these people. So my message again is stick to minimum medicines, because most people with COVID-19 will recover on their own.
Doctor, adding to this, so do you mean that even without those people without COVID-19 infection has a chance of getting this mucormycosis infection? Is that so?
Absolutely. People, as I said, if you look at the series that have come in, let's say I'll give you a couple of examples from Telangana. There's a report on May 29th that only 30% of the people from there are diabetic. And then there are many people who came in who were not hospitalized. Many people had not been on oxygen. Many people had not been on steroids. So this is officially from government sources. I'm quoting from government sources, and many people were non-diabetic. So my point here is there is an extra factor. There is an extra risk factor, which may not just be the virus, because the virus is there all over the world. If
Right.
it was the virus that is causing this immunosuppression and fungus infection, why isn't everyone else coming down with it? So there has to be an additional risk factor, which some people are probably inflicting on themselves. So these are the strongest risk factors that I can think of. And then there was a series from Madhya Pradesh, from Indore, that also said that only about 86% were diabetic. So about 10-15% ballpark figure are really not diabetic. So the question is, what additional factors are these people doing to themselves? That's the question.
There is one more question related to vaccine. Is it true that the immunity developed by the vaccine only lasts for about a year? So does it mean that we have to take vaccine every year? So
That's a
this one
good
answer
question,
should
and
come here.
these questions frequently float in discussion forums. What we must remember is COVID-19 is an evolving science. It's an evolving disease. In other words, the information about it is coming every day. So we can only look at evidence that is available until now. We can't look at, say, this is 2021. We can't imagine that we are in 2015, or we can't imagine we're in 2025 and then say that, immunity lasts for 5 years. We just don't have that, because the disease has only been out for a little more than a year. But I'll tell you some encouraging findings from the best research places in the world. If you wish to check these research papers, you can check my Twitter, which is exclusively dedicated to COVID science. So most of these papers are linked in my Twitter handle as well, with the original publication. So a couple of studies I want to mention here in this context are: one, when we encounter an infection, whether it is a bacterium or a virus or anything else, our body responds by creating what is called memory cells. What are memory cells? Memory cells are a specially designated immune cells whose only job is to circulate, waiting for the next infection to come. They don't do anything else but wait around for the next time the same virus or same bacteria comes in. So let's say we pick up the infection now, or we get vaccinated today. Suppose 6 months later, God forbid, the virus enters our body. These memory cells will immediately swing into action. They will generate huge amounts of antibodies and other immune cells immediately without any delay. And that's their function. And these memory cells are of many categories. There are B cell categories, there are T cell categories, and there are subcategories. And if you look at my Twitter from yesterday, you'll see a very detailed description of each of these categories. Again, for the general audience, I'm not going into much of detail here, but I'll give you the main points. People have looked at up to a year of follow-up in people who've either been vaccinated or natural infection, and these memory cells are still there. We know, in other words, that if you've been vaccinated or naturally infected, at least a year, we know that memory cells are there. So logic says that if these memory cells are there in a year, it's quite possible they may last several years. It's quite possible. Like I said, biological plausibility. It's quite plausible that they will last several years. The question is the presence of these memory cells, is it enough to mount a good immune response against the virus? And I'll take you through a little bit of basic immunology here when it comes to virus infection. Our immunity to this virus infection comes in two waves. Just like pandemic came in two waves to India, immune response comes in two waves. The first is prevention from the virus getting inside our body. That's step number one. Step number two is, if the virus gets in our body, preventing ourselves from dying or from getting severely ill. So these are two separate aspects of our immune system. What vaccines do is predominantly the second. They also stop the virus from getting in about 70 to 80% of the time. But the second aspect, they protect us about 90 to 95%, which means that very vast majority of people who pick up the virus even after vaccination will not die. Of course, there are exceptions, because 95%, which means 5 is still on the other side, right? But 95 is a very good, I'm giving a ballpark figure. The number can vary anywhere from 90 to 100, but about 95% of people are protected from severe disease. So that's the answer, long answer to your question. The question is, how long will immunity last? We know that there is good evidence of our immune system being very active at the end of 1 year. When we can't artificially infect these people with the virus and see if they die, that's unethical. We can't do that. We can only go by observation. But likewise, when we observe people over a longer period of time, we will be able to see if these memory cells last for a very long time. A good number of scientists believe that these memory cells and other aspects of immune system will protect us for many years. So that is the belief. And if they stop protecting us, we will soon get information about people getting infected. And at that point, we will decide that that's a limit of protection. And then at that point, they may need booster vaccines. But as of now, we believe that immunity is extremely long lasting, particularly after 2 doses of vaccine, or in people who've received vaccination after natural infection. The natural infection itself is good, but if we take a vaccination after natural infection, it's at least 50 times more effective protection after vaccination.
Thank you, doctor. Coming back to a question on mucormycosis, Ashish Vaidya has asked, are there any asymptomatic patients of mucormycosis? And doctor, again, I would like to add another question to this, like the common symptoms, what are the symptoms we have to keep check on just to ensure like we are not infected by mucormycosis? There are like 2
Right.
questions. Are there any
Okay.
asymptomatic patients as well?
Yeah. Shall I ask Dr. Neeta to take that question? Dr. Neeta, is she there?
Dr. Neeta, yeah.
Yes. Can you repeat the question, then, Lakshmi?
Are there any asymptomatic patients of mucormycosis? And if you can just list down the common symptoms which we have to keep check on, just to ensure we are not infected by mucormycosis, the common signs and symptoms of this infection.
Okay. So basically, mucormycosis being fungal, we are suspecting you to see what symptoms of necrotic growth. Okay, that is when you will be able to see it as a person. So, anytime you see any blackening of any soft tissues, we are concerning mainly with the head and neck region here. So, we are looking at eye region and nose region, even intraorally inside the mouth. We're looking at the palate, soft tissue, and so if you see any blackening, I think that will be the first time. That's how it's got its colloquial name in the first place. Then again, you are asking me about asymptomatic patients also, as in what?
Asymptomatic patients of mucormycosis, like without they are not showing any symptoms, but they are already
Okay,
infected with this infection. Is there any possibility?
already infected. Uh, you would see symptoms because and basically we are looking at lowered immunity. So if there is any chance of lowered immunity, if you are seeing any nasal discharge, also you would, I think, mostly in most of these cases, you would see symptoms of nasal discharge or any such blackening of soft tissue. Uh, Definitely, because this is the like it is a very active sort of an infection. There's nothing that would be more passive, but
Okay, okay. Thank you, doctor.
yeah.
Um, Dr. Rajiv, there is another question which you have already mentioned about taking steam. So this is a question from Sanjeevan Naik. Taking regular steam damage or good bacteria in the body? So
That's a
this
good
is the
question. See, the problem with steam is it does not come in a fixed dose. So if you take a tablet of paracetamol, it comes in either typically 500 milligrams or 650 milligrams. So you know that if you pop a tablet of paracetamol, we know that you're taking X milligram per kilogram. So we can correctly titrate the dose of paracetamol as required for the person. But steam is different. See, steam, if you ask 10 people how they take steam, you'll get 10 different answers, which means that they're taking it in different methods, different styles, different intensity. And people who trust these WhatsApp messages tend to burn their inside. They take excessive amounts. So we are talking here about excessive and damaging types of use of steam. If all of us have taken steam for a mild cold, it gives you a sense of relief. It's almost like taking a hot bath. You take a hot bath, you feel good after that. It's pretty much it gives you no more benefit to your body apart from symptomatic relief. All right, symptomatic relief is fine. So when you have a temperature, if you put a cold towel on your forehead, you feel so good. Right. Likewise, if you take mild steam when you're having a cold, you feel good because for whatever reason. But it does not, I repeat, it does not kill viruses. And that is the message here. If you try to burn your insides using a device that can potentially burn your tissues off, that's a bad idea. The reason is, I'll take you back to high school physics. This is basic high school physics. Did you know that steam burns are more serious than boiling water? It's a question that you see in every entrance examination. Why is that? Because there is something called latent heat of vaporization. Now, I'll request those who are interested to kindly read up latent heat of vaporization. Latent heat of vaporization is basically the amount of heat that is exchanged when when steam is formed, and that's a huge amount of energy. And an equal amount of energy has to be reimbursed when steam reconverts back to water, and that heat is taken up by the tissue, and that is why steam burns are serious. So, which is why, in an unregulated, unsupervised environment, I would recommend not using it. But if you take very mild steam inhalation with no additional supplements to it, please don't put whatever leaves or whatever it is that you want to, at least for COVID-19, please don't do that for my sake, please, because it will not help you. Trust me, it will not help you. But if you want to have mild symptomatic relief, plain a little bit of very gentle steam, if you want to use it for symptomatic relief, I don't have a problem with that. But my best advice is don't use it because, after all, it does not help COVID-19.
Thank you, doctor. I think you have answered it well. And because there are like common, as you said, through WhatsApp, we listen to a lot of messages and rely on that also. Many people rest on home remedies. As I said, even for dental infections, they just prefer to take home remedies and then avoid these visits. So,
Exactly what I
anything,
mentioned. See, if you look at the most scientifically developed nations with the best cutting edge technology and medicine and healthcare, what are they taking for mild COVID? Nothing. All right. absolutely nothing apart from, as I mentioned in the beginning, reasonable food, plenty of fluids, plenty of rest because your body needs rest, sleep, and maybe, just maybe, a tablet of paracetamol. That's it. 80% of people with COVID 19 in developed nations, this is all that they are taking. So, why should we be different? That's my question.
So you say there is no home remedies for mucormycosis
There's no need.
now.
Yeah, there's no need for any. In fact, the principle that we believe in medicine is first do no harm, right? Even if your body has a fantastic ability to take care of itself, as I mentioned, most of it is still unknown how our body fights infections. Let's not damage its capacity to fight infections. I know what I'm saying is against some of the traditionally held beliefs that putting leaves in steam and other things will help you. But you know what? I speak science, and if you follow pure science, you'll see that what I said is absolutely true. So that's what I'm trying to say. COVID-19 will cure itself in 80%. It will, but under monitoring.